My best insight is definitely the shortest description ever of the social determinants of health that was given first thing this morning. Around it's all of those aspects that don't involve the health system but have an impact upon our health. I'm going to be using that from now on, so that's been a fantastic insight. So short, so sweet.
Yeah, no, I've really enjoyed the morning. It's been great kind of being able to meet people who are working within other sectors and kind of coming at the morning with different approaches. I think this is genius to be able to kind of see from a distance what kind of sector or industry people have come from. And yeah, it's been really great in terms of me being an academic, being able to see how a lot of the work that gets done in kind of academia is then applied, because I'm a big believer in there's no point in doing all this research and kind of building all this knowledge without being able to apply it and ultimately make people's lives better. So it's been really inspiring, and inspiring not only from the talks and the workshops but also from the people I've met.
I feel the conference has been, for me, enlightening and encouraging as well. Hearing about a partnership to raise awareness of the social determinants of health is fantastic. I come from a background in local government, but I also work in public health, so I'm aware of the lack of understanding at times in terminology around things like the social determinants of health if you work in a council. So that's been great. But the other aspect has been around the evidence and bringing that to light for decision makers. How do you get it alive and working for others?
I suppose from the kind of keynote speech this morning, it was interesting because very data driven and kind of quantitative data that was being displayed, and it was interesting to hear how different people picked up on what they were seeing and making meaning behind the numbers. So I'm very interested in income inequality, so I looked at the data and instantly thought financial crash based on the kind of years that were being displayed. Other people kind of saw the kind of rise in social media. Family dynamics, people were looking at it in regards to that, so that was interesting to kind of take me outside my own kind of not inward thinking, but thinking outside of the box in terms of what I'm interested in and seeing how other people applied what they were seeing in front of them. I guess in the workshop I was part of kind of preventing drug-related harm. So hearing people's ideas and kind of perspectives on that, whether it was lived experience or kind of from their workplaces, I found that really interesting, and that kind of combination of people looking at it who were working kind of within kind of public service sector, within the public service sector, but also third sector organisations, and also people who just have lived experience of kind of through family or friends, and kind of bringing that together to kind of think of solutions, I found really interesting.
It's been very informative for me in what I do as a workplace. The contacts I've made are amazing, but the subjects that have been discussed today have really made me think. So I think it's going really well, and we need more of such events to help us get to where we want to be.
I think it's been really thought-provoking. I think it's been interesting to see so many different disciplines within the room. I think that's been really helpful. The presentations have been great, but the workshop sessions in particular, being able to sort of connect with different people has been really helpful. I think it's been a really different Monday than my Monday normally is, so I've appreciated that.
Absolutely. I did sit and think to myself, we're all out there going out to consult and engage with the same communities, while some of this data is already sitting in pockets. Should we be sharing this data? Should we be working more together? So I think that's made me think that I need to be more connected so I can access the data that's already been done. And then it's not about just the data, it's what am I going to do with it to take it forward. So that's really got me excited about what I want to go away with today.
I think I was in the place and wellbeing workshop, and I think it was really interesting just the level of discussion round about the lived experience. I think we're all sort of using it a little bit as shorthand at the moment, but it was interesting to have some community people in there to actually say, you know, what it meant to them to be asked, and the power of that, and the ability that we have as sort of public bodies to be able to influence what they're saying. Sometimes feels quite limited, so it was quite uplifting actually, just to sort of hear them say that it made a difference. So that was certainly one of the takeaways that I'll take.
Yeah, I guess given my work of field, which is equalities, I tend to look at every piece of project from an intersectional lens. So if we were looking at mental health in children, I perhaps would have wanted to see age, the disability intersectionality, the racial intersectionality, you know, their gender orientation, that sort of stuff. So I'd like to have seen a bit more kind of disaggregated data, but then that's more work to be done together. So we can't do that separately. So yeah, absolutely. So I think more of these conferences are needed so we can come back to think together.
Yeah, I think it's been very positive. I have to say, I think the speakers have been very good, and the workshops leading out of those speakers, that certainly that I've been to, have been thought-provoking is what I would describe. Good mix of attendees at it, which I think has been interesting, very useful on a purely sort of almost selfish perspective as a council officer, to hear some of those views that, you know, maybe you don't hear on a day-to-day basis. So yeah, very, very positive.
Yeah, the one thing that I am going to take away from today is going to go and look at what's existing in terms of what's out there already, and then implement it into my workplace. My references to some of the data and research that we've heard about today from the different universities as well, and the professors, and then I'm going to use that to better understand how I can apply it into my workplace and in the area of work that I do.
Yeah, so health and health impacts from a planning perspective are something that we've obviously started to look at in the last number of years, and it's a real focus for the next local development plan that we're working on at the moment. And that sort of evidence gathering that we're doing at the moment, that engagement with communities, I think is crucial. So hearing some of the views that have been expressed today, particularly around how you engage with people, lived experience, you know, how do you capture that, I think is really important, and I think raises some real questions for how we do consultation. And you know, the last speaker, Kat, speaking about sort of quantitative versus qualitative data, I think is a really interesting question for us, because our focus understandably is quite often on quantitative data, you know, how many people have responded, but actually there's a question behind that about what are they saying, rather than just how many of them are saying it. So that's certainly something that I think we'll take away.
Yes, it's been a really good day. Seeing people from different sectors, that's been very encouraging, getting to meet new people. The subject of the day has been something of very much relevance, not just to myself, but to everyone in the room. I really enjoyed Professor Eugenio's presentation around mental health and correlation to data, but also identifying that data isn't the full depiction of the story behind the data, so giving that. But what was quite interesting was being able to correlate it to the timeline, and a lot around young people talking more about mental health. And I think that was quite an interesting area for me, was where more young people were speaking about their mental health, and then you had older people whose mental health seemed steadier, well, compared to young people. And it got me thinking that could that be associated to young people being more confident in expressing what they experience. And I think that goes back to what he was saying about the story behind it, but it also got me thinking as a parent myself about being more conscious about the mental health of my young one.
In terms of things that we haven't heard, I think I would certainly like to delve a little bit more into that experience of communities within the city. I accept that at this stage we're sort of setting the scene with the conference in terms of trying to make those connections, but I think trying to dive down into, particularly when you look at the index of multiple deprivation, you know, some of those communities within the city that have been left behind economically, you know, socially in some cases, trying to get some of those voices, I think would be interesting for future iterations. You know, it's all very well me or other academics speaking about that, but I think it would be interesting to actually hear some of those voices perhaps the next time.